Hi, I'm Cheryl Leslie, registered dietitian at the Center for Cancer Care at White Plains Hospital. In this video, I'm going to discuss how to reduce cancer risk by limiting alcohol consumption. Now, in my experience of all the guidelines that are given to reduce the risk of cancer, this is the one that can be most upsetting to people. Alcohol can be a huge part of many people's social life. People use it for relaxation, for celebration, or to bond with friends and family. So the thought of needing to limit or avoid alcohol can be quite upsetting for many people. I'm often asked by people, but I thought drinking wine is healthy for me. There have been a lot of new studies in past years on the benefits of wine for heart health. And studies do suggest that some people, but not everyone, who drink small amounts of alcohol, which is only 1 drink a day, may have a lower risk of coronary heart disease than non-drinkers. But in touting the heart benefits or the potential heart benefits of alcohol intake, what is not discussed is that alcohol increases the risk of many cancers. In fact, there are 6 cancers that have a direct relationship between drinking alcohol and cancer development. That is breast, colorectal, cancer of the esophagus, of the liver, of the mouth, pharynx, and larynx, and also of the stomach. Women in particular who are at high risk of breast cancer should not have any alcohol at all because there's a very strong relationship between alcohol intake and breast cancer. So the reason that alcohol increases the risk of cancer is that all alcohol contains ethanol. And when ethanol is processed by our bodies break it down to a chemical called acetaldehyde. Now, acetaldehyde damages your DNA and prevents your body from repairing the damage that is caused by the acetaldehyde. As a result, our DNA does not work properly, and this can lead to cells growing more than is intended. Cancer can develop from this excessive growth of the cells. So the recommended guidelines based on the research that we have is that to lower the overall risk of cancer, women should have no more than 1 drink a day, and men should have no more than 2 drinks a day. Now, this doesn't mean that if you don't drink all week, you can have 7 drinks on a weekend. We know that the more drinks we consume, the higher our risk of cancer, of getting these 6 cancers in particular. And we know that even having just a small amount of alcohol increases our risk. So if you do decide to drink alcohol, your goal really should be to have as little as possible. And cancer risk does not differ based on what kind of alcohol we drink. Whether it's beer, wine, or distilled liquor. 5 ounces of wine is equivalent to 12 ounces of a regular beer, which is equivalent to a shot glass of a hard alcohol. They all contain the same amount of ethanol, and they all break down to acetaldehyde. The one thing I want to also mention is for wine drinkers out there, whenever you drink wine, it's important to pay attention to portion sizes. A portion of wine is only 5 ounces. So if you're pouring yourself some wine out of the bottle and you have a very large glass, you may be pouring yourself much more than 5 ounces and be having more than the 1 serving a day. That is recommended for women or 2 for men. Now, if you choose to drink despite the cancer risk, I strongly recommend limiting the amount, as I said. You can try some of these tips to cut back on the amount of alcohol that you drink. So if you're having some wine, consider adding some seltzer to it to make a wine spritzer. You will need to use less wine in it, or if you use the same amount of wine and add the seltzer to it, your drink will last longer, resulting in hopefully less alcohol intake overall. You can think about alternating rounds of having an alcoholic beverage with drinking some water or some other non-alcoholic beverage. So if you have 1 drink, make your next drink a water before you order another alcoholic beverage. Drink your drinks slowly, right? Savor them, make them last so you're having less alcohol at any given evening or day. Don't do shots, avoid ordering doubles. right? Your goal is to have as little as possible. You can ask a bartender or a waiter to bring you a lighter drink that has less than a shot of hard alcohol in it. That's another way to cut back. You think about having a non-alcoholic drink, such as a non-alcoholic beer or a Virgin Mary. No one will even realize that you're not having an alcoholic drink. And I would suggest that you avoid drinking every day of the week and maybe save it for social occasions as another way to cut back. So I hope this video answers many of your questions regarding the role of alcohol on cancer risk. If you have any questions on this topic or any other nutrition topic, please feel free to reach out to me at the Center for Cancer Care. Thank you.